As many people with less severe cases will have to deal with their coronavirus symptoms at home. And in your report this morning, ABC 10 News reporter Jared Aarons spoke to doctors and pharmacists to find out the most effective ways people can treat their own symptoms while they recover.
It's important to note every medical professional I spoke to told me you should talk to your doctor or healthcare provider first before you try any treatment. They said the most common symptoms they're seeing for COVID are fever, aches, cough, and shortness of breath.
When patients are diagnosed with COVID-19, one of the first things they're told is go home.
Sharp Healthcare Pharmacy Supervisor Marissa Corey says home is where most COVID patients will treat their disease. And for most symptoms like fever or aches, an over-the-counter pain reliever like acetaminophen works best. When it comes to a cough,
we can use the time-tested remedies. So a humidifier, a vaporizer work great to help soothe and control a cough.
So do over-the-counter medicines. Your doctor may tell you to look for the active ingredient guaifenesin, an expectorant, to help cough out built-up mucus or fluid. If you have a dry cough, medicine says a cough syrup with dextromethorphan works as a cough suppressant. For shortness of breath, experts advise lying face down in the prone position.
And that can help the mechanics of the lung and gas exchange as far as breathing is concerned, but it needs to be done cautiously.
Dr. Atul Malhotra is the research chief of pulmonary critical care at UC San Diego. He put out a study showing proning helps with COVID patients in hospitals. He thinks it can be done at home, too, if your doctor is on board. Malhotra says proning can increase ventilation and relieve stress on the lungs.
So, for example, the weight of the heart can go more on the sternum, the breastbone, rather than kind of squishing the lung. That's at least one way to think about it.
He also says something as simple as blowing a fan over your face can trigger nerve reflexes in your body to help relax and regulate breathing. Corey adds movement, like a simple walk around the house, and deep breaths can help as well.
Taking deep breaths to help clear anything in the lungs, that can help facilitate a better recovery and oftentimes prevent or reduce the need for advanced treatments.
Meanwhile, a November study from North Carolina State found that green tea, dark chocolate, and certain types of grapes can fight the disease by blocking enzymes that help COVID grow inside your body. Corey says they may not be a Hail Mary cure, but they can combine with other home-based comforts to make people feel better.
It's time to get that favorite book, make some phone calls to friends, let everyone know you're okay, and stay positive.
One other important thing, sleep and rest. Dr. Malhotra told me that sleep deprivation can lead to pneumonia and also make it harder for your immune system to fight any disease. Jared Aarons, ABC 10 News.